Hi, Thina. Some people think I'm old-fashioned. They say I don't like new things. But all the psychiatric drugs people in this town take is all bullshit. They even give those garbage drugs to little girls like you. This is total bullshit.
Mr. Rockwell, why do you say that?
Psychiatric diagnoses make no sense.
But my mom feels depressed. Therefore she has the disease depression. And since I get bored in school, I take ritalin for attention deficit disorder. My psychiatrist told me I have a chemical imbalance in my brain.
Well, Tina, let me ask you this. Imagine your arm hurts, so you go see your doctor. Without even looking at it, he diagnoses you with arm pain, and then gives you painkillers. Would this make sense? Is arm pain a real diagnosis?
No, of course it isn't. The diagnosis is supposed to be the problem that's making the arm hurt. The pain is just a symptom of a deeper problem.
What if the doctor tells you that occasional arm pain is normal, but if it happens all the time it indicates either a major arm pain episode or a generalized arm pain disorder? Would you be satisfied with this explanation?
No, I would not. Common sense tells me that as bad as arm pain may be, it's something I feel and not a disease that I have. Even if the arm pain never stops and it is so bad I want to kill myself to stop it, it is still something I feel and not a disease I have. The doctor is supposed to diagnose the disease. It is stupid for a doctor to feed a patient's symptoms back to them with a fancy label and call it a diagnosis.
According to psychiatry, major depressive episode is the diagnosis for someone who is feeling depressed. How can depression be both a symptom and its own diagnosis?
Well, now that you put it like that, I'm not sure psychiatry makes sense after all.
According to psychiatry, a generalized anxiety disorder is the diagnosis for someone who feels anxious a lot of the time. They just take someone's mental symptoms, feed it right back to them, and call it a diagnosis.
Maybe my attention deficit disorder is all bullshit also. I can't pay attention to my boring teacher, so they diagnose me with lack of attention disorder. But I can pay attention when I'm outside of school and doing something meaningful to my life.
What you should really do with that ritalin is force feed it down your psychiatrist's throat and see how he likes it.
But Mr. Rockwell, what about the chemical imbalance they said I have?
Did they do a blood test or anything like that to show you there is a chemical imbalance?
No, they said there are no tests. It is diagnosed by my behavior.
Do you know what that really means?
I think I understand it all now. There's no chemical imbalance, it is all bullshit. Psychiatry is all lies and bullshit. I will not take any more ritalin. Thank you, Mr. Rockwell.
I'm glad I could help.
Mr. Rockwell, can you help me with something else?
What is it, Tina?
My psychiatrist's office is down the block, and I just picked up my ritalin for the month. Can you go over there and hold him down while I do some forced feeding?
It'll be my pleasure.